Nothing written on the back or the front. All right, I'm Molly. I'm going to be doing a head-to-toe assessment on you today, Dad. I'm going to wash my hands with some hand sanitizer here. Shouldn't take more than 20 minutes for the head-to-toe assessment, and then I'll be out of your hair.
Okay.
If all goes according to the plan.
Sounds good, Molly.
We'll start out with the eye exam first.
Okay.
So you just look straight ahead. I'm going to shine a light near your eyes, not in your eyes. Good. And just follow the tip of my finger with your eyes, trying not to move your head. All right, relax. And you're just going to follow the tip of my finger again in towards your nose. Very good. Pupils are equal, round, reactive to light, and accommodate. Moving on to the cranial nerve exam. We'll start with cranial nerve 1, which is the olfactory nerve. I'm going to hold a very common household substance in front of you. You just close your eyes. You tell me what you smell. All right, go ahead. Close your eyes.
Morning coffee.
Yeah, excellent. All right, go ahead and open your eyes. Cranial nerve 2 is the optic nerve. So I'm going to hold a magazine out in front and you just tell me what the headline is.
Untamed. No doubt.
Excellent. All right, cranial nerve 3 is the ocular motor and cranial nerve 4 is the trochlear. Those were both tested during the eye exam earlier. So moving on to cranial nerve 5, which is trigeminal. We have a pencil here. The point of the pencil is sharp. Eraser is dull. You're going to close your eyes. You just tell me what you feel.
Sharp. Dull. Sharp. Sharp. Dull. 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 Sharp.
All right. Cranial nerve 6 was also assessed during the eye exam, and that is the abducens nerve. Moving on to cranial nerve 7, which is the facial cranial nerve. I'm going to have you make a couple funny faces.
Okay.
You're going to raise your eyebrows really high. All right, relax. Smile really big. Relax, and then puff out your cheeks. Excellent. Okay, cranial nerve 8 is the vestibular cochlear nerve. So I'm going to just sit behind you, whisper a pretty common phrase, and you repeat back what you hear.
Okay.
Okay.
1, 2, 3, ABC.
Very good. All right. And moving on to cranial nerve 9, that is the glossopharyngeal nerve. So for that, I'm going to have you go ahead and just take a sip of water.
Okay.
Just from the tap. We test cranial nerve 9 with cranial nerve 10, which is the vagus nerve. Just kind of checking the way that our patient swallows. If you want, you can open, stick out your tongue and say ah. Good. Uvula is midline and intact, so that's all good. Cranial nerve 11 is the spinal accessory nerve, so I'm going to press down on your shoulders, and you just go against my resistance. Okay. Good. And same thing with your head. Turn to the left and the right. Very good. Okay. And cranial nerve 12, last but not least, I'm going to have you stick out your tongue, and then up, down, side, then side. Very good. Okay. So eye exam is complete. Oh, for the neurovascular, we'll also do 3 deep tendon reflexes. So we'll start with the triceps reflex. Usually we would do this with a reflex hammer, but we're going to use a spoon today.
Okay.
So go ahead and you can cross your ankles if you would like, and just go ahead and pull against that resistance against your own legs.
Mm-hmm.
And I'll take your arm. Yep, just completely relax. Give me your weight. Good, good. Okay, let's see. Okay. Good. And the other side as well. You can keep pulling against those legs. Distract yourself a little. Good, good. Okay. Triceps reflex is active bilaterally. We're going to go ahead and do the patellar reflex bilaterally as well. For this, if you want, you can interlock your fingers, pull against that, and relax relax your knee. You could scoot back on the bed if you'd like to keep your feet off the ground. Perfect. Okay. Pretty good. All right. Patellar reflex active bilaterally, and lastly, we'll do the Achilles reflex. So I'll have you just kind of turn to your side. If you want, you can keep interlocking those hands and just kind of let your leg relax as much as possible. Let it go limp. I know it's hard. Okay, very good. And we'll switch sides if you don't mind. Sorry. Okay, relax. Let it go, let it go. Okay, very good. Achilles reflex active bilaterally as well. Neurovascular exam is complete. We'll do the musculoskeletal exam next. So we're going to do abduction with the shoulders and adduction. Abduction is going to be up to the sky. Adduction back in towards your body. So go ahead and do that with me if you can.
Okay.
Good, and back in nice and relaxed. Excellent, and we're gonna have you go out to the front. Palms facing down, good, and back in. And then you can kind of swing your arms around a little bit. We're gonna do the back as well, so we want to send them back like that. Palms up to the sky and back down.
Okay.
Good, good, good. Full range of motion in the shoulders, and we'll check the hips next. So if you don't mind just laying back for me on the bed.
Okay.
All right, and bring your knee in towards your chest. Excellent. You can kind of relax. I'm going to move it a little bit. I'm going to check internal rotation and external rotation. Good. Other side. Knee in towards your chest. Internal rotation and external rotation. Very good. Relax. All right, patient shows full range of motion in the hips as well. While you're laying back, I'll do the abdominal exam so we don't have you standing up and laying back and standing up and laying back.
Sounds good.
All right. So I'm just gonna listen to the bowel sounds with the diaphragm of my stethoscope, which is probably really cold. So I apologize. We like to listen until we hear at least one little gurgle, if not a few. Bowel sounds are active in all 4 quadrants. I am going to do some palpation next. Light palpation first, but you stop me if there's any tenderness, okay?
Okay.
All right. We do light palpation just with one hand. That felt all right?
All good.
Deep palpation by manually. No tenderness there.
Still okay.
Excellent. You can go ahead and sit up. No apparent masses or tenderness or swelling or edema. We'll go ahead and do the lungs and thorax exam next. Just going to listen to your lung sounds. All you have to do is just breathe in deep, breathe out deep.
Okay.
Excellent. Okay. Excellent. Breath sounds are clear, no adventitious breath sounds such as crackles, wheezing, or rales. Bronchial lung sounds around the trachea, which is appropriate. That's what we'd like to see. Bronchiovesicular lung sounds surrounding the the sternum. Last one there, very good. We're gonna check the peripheral lung field, so I'll have you lift up one arm. I'm just gonna listen to your lungs on this side if you don't mind. A big deep breath there. Good. Vesicular lung sounds on the peripheral lung fields. We're gonna check the other side. Big deep breath. Good. Again, breath sounds are clear, no adventitious breath sounds there, and vesicular breath sounds over the peripheral lung fields. We're going to go ahead and do the back here. So again, continue those big deep breaths for me. Bronchiovesicular breath sounds surrounding the scapula, which is appropriate. Breath sounds are clear. No adventitious breath sounds such as crackles, wheezing, or rales. And just 2 more big deep breaths after that. Again, vesicular lung sounds in the peripheral lung fields. Very good. Breath sounds are clear, no adventitious breath sounds. Excellent. We're going to move on to the cardiovascular exam next. So we will assess for edema and palpate pulses and such. So edema, I'll just have you relax your arms at your side. Just kind of assessing for any swelling. No edema present, and we're going to palpate pulses next. Roll them down here. We'll do the dorsalis pedis pulse bilaterally. Just checking these to grade their strength. Dad has a pretty strong pulse like me, so dorsalis pedis pulse about a 2+. Posterior tibial is on the medial side of the ankle. Again, about a 2+. Popliteal is behind the knees and femoral is in the groin, but we're not doing either of those today. We're going to move on to brachial, so go ahead and put your palms face up for me against the bed. That's fine. Assessing brachial pulse. Again, that's about a 2+, and carotids, not at the same time, but we're going to check that bilaterally. Carotids are about a 3+. Like I said, Dad has a pretty strong pulse, like I do. 3+ bilaterally. Let's see, what else are we doing? We'll listen to your heart sounds and count your apical pulse next. So listening with the diaphragm first and then the bell, just over all the major valvular areas. So just kind of relax as much as you can. Okay, S1 and S2 are present. We're going to listen, flip it and listen with the bell now for any turbulent blood flow or any abnormal heart sounds. Again, S1 and S2 are present. No bruises or murmurs or any other turbulent blood flow. We're going to flip it back to the diaphragm now and count the apical pulse for a full minute, so sit tight while that happens.
Okay.
Okay. About 67 for that apical pulse, which we know to be Dad's resting heart rate. Let's see, abdominal exam, lungs and thorax, cardiovascular, eye exam. we'll do the cervical nodes, and I think you should be good to go after that.
Okay.
So for our cervical nodes, we're going to do both sides at the same time. We have, you can just stay there if you want. We have the preauricular, posterior auricular, occipital, retropharyngeal, submandibular, submental here under the chin, deep cervical chain, supraclavicular, posterior cervical, and superior cervical. None of that was too tender for you?
Nope, all good.
All right, not tender, and cervical nodes were also non-palpable, which is what we like to see in adults, either non-palpable or very, very small. And like Dad said, non-tender, indicating no sign of infection. And thank you so much for being so cooperative. I think we're all set.
Thank you, Molly.